with Roseanne tomorrow. Let me begin by thanking Roseanne and by thanking the 185,000 members of the National Nurses United for inviting me to be with you today. But more importantly, nurses, let me thank you for what you do every single day. The nurses are the backbone of our healthcare system. They are there when we are born. They are there when we are sick. They are there when we are on our deathbeds. Thank you, nurses, for everything that you do for the American people. And I want to say something else about National Nurses United. It is hard enough to do a difficult job, like being a nurse, going out there, doing all that you have to do, dealing with the emotional stress of seeing loved ones die and suffer. But what nurses understand is that for them to do the job they love and are trained to do, they understand they cannot function effectively in a dysfunctional healthcare system. How do you do your job well when people walk in the door and have no health insurance to pay for the therapy and the procedures and the medicine they need? And that is why the National Nurses United has been leading this country in the fight for a Medicare for all single-payer system. Thank you, nurses. It seems to me now that we have, in this pivotal moment in American history, two major tasks in front of us. First, we have got to beat back the reactionary agenda of the Trump administration. This is an agenda designed to benefit the billionaire class and to ignore the needs of the 99%. It is also an agenda which, in an unprecedented and ugly way, is trying to divide this nation up on the basis of the color of our skin, our sexual orientation, our religion, or the nation that we came from. And our message to the Trump administration is, you are not going to divide us up. We are going to stand together. We're going to take you on, and we're going to defeat you. And we tell Mr. Trump and his friends they are not going to take away the legal status of 800,000 young Americans. And we are telling Mr. Trump and the Republican leadership they are not going to give huge tax breaks to the 1% and then cut back on education, environmental protection, and the needs of our children. And today, the immediate crisis we face from Trump and the Republican leadership is another piece of horrific legislation that would throw 32 million Americans off of the health care they currently have. I want you all to think, get beyond politics for a moment, and think if today you are an American dealing with a life-threatening illness. Maybe you have cancer. Maybe you have heart disease. Maybe you have diabetes. And what keeps you alive is the health insurance that you currently have. how cruel, how immoral it is to say to those millions of Americans, we are going to take away that health insurance that keeps you alive. And we say to Mr. Trump and the Republican leadership, you are not going to allow thousands of Americans every single year to die unnecessarily. We're not going to let you pass that horrific legislation. Now, we defeated a Republican proposal that would have thrown 23 million Americans off of health care. We defeated a Republican proposal that would have thrown 22 million people off of health care, that would have thrown 16 million people off of health insurance. And now we are going to defeat another proposal which is even worse than the previous ones. Now, this particular proposal, the so-called Graham-Cassidy bill, would be especially devastating for those states like Vermont and California that have done the right thing by expanding Medicaid. In California alone, you would lose more than $55 billion in federal health care money over a 6-year period, more money than any other state in the country. In this state alone, if you can believe it, just in California, over 4.5 million people would lose the health insurance they currently have. And in California and all across this country, if you are an older worker, you're 60 or 62 years of age, understand that if this legislation passes, your premiums are going to skyrocket. They're going to soar. And millions of older workers in this country, at a time when you need health insurance most, will not be able to afford that health insurance. Now, in the midst of all of that bad news, I am very happy to give you some very good news, and that is, as some of you may know, just a few hours ago, Senator John McCain of Arizona has just announced that he cannot, and I quote, in good conscience, vote for the Graham-Cassidy proposal. Thank you, John McCain. And John McCain has a conscience, and I wish very much that the rest of the Republican leadership had that conscience as well. You know, I've known John for many, many years, and we have very fundamental political disagreements, but over the years, he has shown incredible courage, not only as a prisoner of war, but also as the co-author of the McCain-Feingold campaign finance law, which attempted to get a handle on one of the great crises we face, and that is billionaires buying elections. And John, of course, was one of the Republicans to vote against the last Republican bill and helped defeat that. But even with Senator McCain's opposition, our struggle on this legislation is not over. And our job is to continue to make sure that the Republicans do not get the 50 votes they need, which plus the vice president's vote will give them a victory. So I beg of you, please do everything you can. Get the word out all over this country to your friends, to tell them that no Republican should vote for this disastrous bill, and if they do, they will pay a very heavy political price for that. And while we have got to wage an all-out battle to defeat this horrific legislation, we have also got to understand that in terms of health care, maintaining the status quo is just not good enough. Our job is not just to prevent tens of millions of Americans from being thrown off the health insurance they currently have. Our job is to join every other major country on earth and guarantee health care to all as a right, not a privilege. The time has come for a Medicare for all single-payer program, and I am proud to stand before you having introduced that legislation in the Senate with 16 co-sponsors. Today, we stand together in saying that in this great country, health care is a right, not a privilege. Today, we say that we are sick and tired, and the nurses know this better than anyone, of seeing people who are sick not able to go to the doctor or the nurse because they have no health insurance or the deductibles or co-payments are too high. Today, we begin the debate vital to the future of our economy as to why it is that in our country we are now spending almost twice as much per capita on health care as do the people of any other country. Why is it that we are spending in this dysfunctional healthcare system almost 18% of our GDP on health care, a number which, if we don't change the system, will only rise in the years to come? And today we say that the function of a rational healthcare system is not to make billions in profit for the drug companies and the insurance companies. The function of a rational healthcare system is to provide health care to all people when they need it, and not to argue with the insurance companies as to whether or not they are covered for the procedures that they paid for. And today we say to those families in California, Vermont, and all over this country who are spending $10,000, $15,000, $20,000 a year on health insurance, that we know that this is an insane amount of money to be paying in order to protect your families. And we are here to tell you that under a Medicare for all single-payer system, the cost of health care for the average middle-class family will significantly decline, and that family will be much better off than under the current dysfunctional system. Now, my Republican friends will tell you that you may have to pay more in taxes, and depending on your income, that's true. But what they won't tell you is that you're no longer have to pay that $5,000, $10,000, $20,000 a year to the private insurance companies. And today we tell the drug companies, we are sick and tired of being ripped off by your greed. We are tired of having 1 out of 5 Americans under the age of 65 not being able to afford to purchase the prescription drugs their doctors prescribe. Can you imagine how crazy that is? And at the same time, the top 5 drug companies last year made $50 billion in profit. So we say to the drug companies, we are going to end your greed, and under Medicare for All, we're going to negotiate prices with the drug companies. And today we say to the small business community, get on board Medicare for All because it's going to benefit you substantially. Right now, all across this country, small businesses are spending an enormous amount of time and energy and money trying to figure out how they're going to provide cost-effective health care to their workers. Under a Medicare for All single-payer system, that worry is gone. All of your workers will have health care as a right. And today we say to millions of workers all across this country who are at jobs they would rather not be at, except for the fact they have decent health care on those jobs. Think about in America where everybody has health care as a right, and you can go out and start the businesses and do the jobs you love rather than staying in a job you don't want to be at. So health care for all in a Medicare single-payer system is not only good for patients, it is good for the business community as well. 52 years ago, as you all know, President Lyndon Johnson signed historic legislation that said that in the United States of America, if you are 65 or older, you will be guaranteed health care as a right. And that legislation, that Medicare legislation, has been enormously successful. Seniors in America are healthier and more secure by far than before the passage of that Medicare legislation. And today we say that Medicare for senior citizens has worked, and we want Medicare to work for every man, woman, and child in this country. And by the way, I say to seniors that Medicare today is a strong program. We intend to make it stronger by, for the first time, including coverage for dental care, hearing aids, and vision aids. The Affordable Care Act, I think, as we all know, made significant improvements to our health care system. It provided health insurance to 20 million Americans who did not have it. It did away with the obscenity of insurance companies denying care to people with pre-existing conditions. But we must be honest and acknowledge that with all the gains of the ACA, it has not gone far enough. 28 million Americans still have no health insurance, and many more are underinsured with high co-payments and high deductibles. And our job today is to say that we are going to have a health insurance that does away with all co-payments, all deductibles. Brothers and sisters, we understand that the fight for a Medicare for all single-payer system is not going to be easy. Last year, I was here in California in support of Proposition 61, a proposition that would have lowered drug costs in this state. the pharmaceutical industry spent $130 million to defeat that legislation in one state. If they spent $130 million in one state to defeat one referendum, think about what they're going to be spending all across this country to defeat a Medicare for all proposal. So our job is to understand that we're going to be taking on the drug companies, we're going to be taking on the insurance companies, we're going to be taking on the medical device companies. But you understand and I understand that when the American people stand up together, we're going to win this fight. And I'm happy to tell you, and this is really good news, not only do we have 16 co-sponsors in the Senate and a whole lot of co-sponsors in the House. In addition, every poll that I have seen indicates that more and more Americans support a Medicare for all single-payer program. What this struggle is about literally goes far beyond health care. It is a struggle about what this great nation stands for. It is a struggle about whether or not every working person in this country has health care as a right, or whether we allow insurance companies and drug companies to continue to rip us off. It is a struggle about whether Congress listens to the American people or listens to the billionaires who make huge sums of money off of the current system. So let me conclude by saying this. This is the year 2017. For decades, great Americans from FDR to John F. Kennedy to others have talked about health care as a right. After decades of talk, now is the time to get it done. So I want to thank our sisters and brothers in the National Nurses United for helping us lead this effort. And I want to thank people all across this country who are literally saying enough is enough, who are saying that it is an international embarrassment that we remain the only major country not to guarantee health care to all, who are saying that it is economically unsustainable for us to be spending $10,000 per person on health care. So our job now is to bring our people together. We're going to defeat this disastrous Graham-Cassidy bill, and then we go on and pass Medicare for all. Thank you all very much. Thank you.